Okay. Hi, everybody. Good morning. Welcome. My name is Jenna Sistad, and I am the project manager of Ocean Monmouth Health Alliance, which is our region's cancer and chronic disease prevention coalition, funded by the New Jersey Department of Health, and run through the Children and Family Health Institute with VNA. Thank you for being with us. Today's session is part of our Health to Hold series, and we do this on a monthly basis so we can recognize not only our Health Awareness Month, but also the great work that many of our partners are doing. So this morning, we are recognizing National Immunization Awareness Month, and we have Scott Carter from the Ocean County Health Department with us to take us through some education. So welcome to Scott. Thank you, everybody, for being here. If you wouldn't mind, please keep yourself muted until our Q&A at the end, and put your name and contact information into the chat box. Welcome again, and thank you, Scott, for doing this with us. The floor is yours.
Yes, ma'am. Good morning, everyone, and thanks for the invite. So as we talked about of August being National Immunization Month, it's a great time to kind of transition into our fall flu season. As we start getting our older kids back to school, we start getting our younger kids back to class. We start seeing a change in some of our general health over the next couple of months. So we took the opportunity just to talk a little bit about recommendations for vaccines and how to try to keep each of us healthy and really our family kind of healthy as well. What I'm hoping to talk a little bit about today is the objectives that we look at from our community health assessment needs as a public health provider, but we also build in what's known as the Healthy People 2030. So that's kind of the goals of where public health and healthcare try to be and try to set. And we focus on that as we get out to some of our communities. So my wants today is really for anybody that's on the conversation is that open discussion about the importance of vaccines. Just where do you sit? Where do we stand as a nation? Where do we stand as individuals trying to keep our children and our families safe? How do we create preventable vaccines? How do we prevent our younger individuals from, if they get sick, keeping them less sick, keeping them out of the hospital, trying to keep the families that are really intact. And then the goal is that as our younger kids go to school, there's some state requirements that we have to talk about and to keep them in school with the requirements for vaccinations. And then we talk a little bit about the vaccinations and how do you track them? How do you know where your child is today or even yourself? What are those options to each of us? And then we talk a little bit about the advantages of getting vaccines as early as we can with that. The three simplest of ways is through just having an understanding of what's out there for vaccinations. What is a requirement for your children? What is kind of an option for each of you as individuals? There's a lot of belief, there's a lot of disbelief, there's a lot of uncertainties in terms of vaccinations. And it's more about how do you educate yourself on what's going on. Having that, if you're strong in vaccinations, that's wonderful. If you're not really sure if it's the right thing for you or your families, what resource can you go to? From the Centers for Disease Control to the American Academy of Pediatrics to maybe I'm a potential mom and what do I need to think about from my OBGYN and those practices to be able to give you those resources to kind of just sit back and do your own research and not kind of get caught up in what's going on in some of the messaging and social media platforms that can become distracting to some people. And then ultimately, really, it's at number three is when it's time to sit with you and your physician to have that conversation of what's right for you and what's right for the family, what's right for the health that's going on within the families, really kind of getting that guidance. And that's really where we kind of focus is the guidance of our healthcare providers that we like to kind of work about. But seasons are changing. As we get now into the cooler months, which we've experienced just this week alone, we're starting to see the sniffles. We're starting to see the cough. We're starting to see a little bit of resurgence of not only a little bit of COVID right now, but we're starting to see early RSV type of vaccine, illness that is starting to kind of present. That's where we're at, very early on, but we want to be able to watch it and just kind of have an understanding of how do we get this protection? How do we maintain protection? So I'm showing you right now the 2024 immunization schedule. I did not put the 25 one up just yet because there's a lot of controversy going on from the Health and Human Services Director and the Secretary to the pediatrics world as to what is and isn't really a recommendation. And again, mostly it's all focusing around COVID still. But the main 14 diseases haven't changed. So I didn't want to give you something that kind of may change within a day or two. But these are the recommended vaccines for you and your child that should be as part of their normal growing series. From the chickenpox to the flu to the hepatitis, the measles, the mumps, and the rubella, really something that's something you should be considering as we see a nationwide outbreak that's starting to go on. To include whooping cough or the pertussis, because we're starting to see that illness start to come back that we haven't seen in many years, and it's starting to become a little bit more of a concern or so. So these are the minimum requirements that we want to have our children in, and this is the guidance that your physicians are really going to focus on is this table of recommendation. I do think the 2025 one will be solid in terms of its recommendations, probably by the end of September, but they do change from year to year in general. And one of the other ways to kind of track the information for your child or where you sit is what's known as the Immunization Information System. New Jersey has their own called NJIIS. This is a database that all of your pediatricians, most physicians, most pharmacies feed into to keep records centralized. So this is an opportunity that where you can pull up this database and see all of your child's records and even your own records, and when you last had those vaccines, when the next vaccine is due based on age, based on the slide that we just saw today. It also feeds into any provider could then look at this record from a pediatrician to a general practitioner to a nurse practitioner to really see where you're at if there's a need to make up some vaccines or if you just needed documentation for yourself to be able to provide. The New Jersey app is really the easiest. It's a free download. It's really simple. It's a setup as easy as your first and last name and a date of birth. They match that to the state records, and you have it right there as an app. Something that is really recommendable for general public to use. And it's what it kind of looks like. It's a really easy sign up, and the information is so user friendly to be able to have that information. And it's really the idea is we capture all that data to see where do we stand in the state of New Jersey and throughout the nation of who's vaccinated, what's the percentage of vaccinations, because we're seeing these illnesses starting to come back. We're starting to see some of these outbreaks. And we can try to focus on those outbreaks through education and identifying how do we get these vaccines out. The big ones that we are seeing that I have listed here is pertussis or whooping cough. We do have some measles, and we have 7 cases of measles throughout the state right now here in New Jersey. Not really outbreak, but those are individuals that were not vaccinated as of yet. Chickenpox, which is a very common, and then of course the flu. The goal is, as we vaccinate ourselves and our families, is for those individuals who can't get vaccinated, those that are underneath of 6 months or 1 year, we try to keep them protected by vaccinating ourselves. We do our absolute best to kind of keep us vaccinated to prevent those older grandma, grandpa's parents who can't get vaccinated because of an illness as safe as we can. And you may have heard that called herd immunity. We want to vaccinate as many as we can to protect those that truly cannot get vaccinated. And this is really the goal of preventing those outbreaks. As we look at those outbreaks and we try to get that preventional piece, this is just one of the school requirements that your children are mandated, if we want to use that word, but there's some variables to that under this New Jersey administrative code that says that children in certain grades and up to certain ages must have the minimum vaccinations. So what does that really mean? Every year, we here at the health department audit all of the schools from the private to the public schools, looking at all of the records that are located within the child school center with the nurses to make sure that these minimums are in place. If for some reason one of these minimums is missing, the school works with you as parents to make that notification to get that vaccine as required. There's some variables, and those variables allow each family or so to determine that no, I don't want my child to have that, and that's okay. You can go through a process that just abstains you from having it, and it just has to be some documentation that's in the file. So although it's a state mandate, it's there. You have a right as a parent to choose what you want for your children. But these are the minimum recommendations that we really try to do to keep our children as safe as we can, and reduce that spread. So with that, our goal here at the health department and part of our community health need is to get out to that public to help the mom, dads, grandma, grandpas who want certain vaccines but just can't make it or need to take a day off of work. We know that that's troubling. So we've created our flu program for 24, 25, 25, 26. And that program is where we're out to almost every community in Ocean County on 2 or 3 occasions between now and December, from early evenings to later evenings to weekends, to allow the mom and dads to be able to get this vaccine for the flu vaccine for their children and from themselves without taking off time of work. We have a drive-through program that we have at Ocean County College that you don't even have to get out of your car. We really try to make our flu program as convenient as we can. And this was just 2024's. Our 25 stuff is due to come out this week, but you can kind of get a sense of where we're at throughout the county, along with our static locations of Ocean County College and here at the health department. Not only are we working with flu, but we also have the ability to provide pneumonia for certain individuals of age. The COVID vaccine is still hasn't been approved yet, so we're still not sure where we're at with that. But our tetanus, our Tdap, all of those programs that we have available to our families and to our parents, if needed. So if that's something that you're not sure about or something that you're interested in, and I believe Natalia will share some of that information in the chat group really soon.
Scott, I
Yeah.
put that in there. Sorry to cut you off, but I put the updated calendar in there for anyone that's interested.
Okay, perfect. Thank you. I don't see the chat from me. So that information is available for each of you. Or if you're a partner of ours and you have a family that doesn't really know where to go, these are programs with and without insurance. Which is kind of really important. So we have that ability to provide vaccine for all, with or without that insurance, and even so with or without ID. So if we're dealing with those that may be through an immigration piece or still kind of working through that, we don't say no, and we have that ability to do that vaccine as well. So that's kind of the program that we focus on, and we look at these vaccinations is that we want to make sure that we try to keep our child on task and on schedule. If we miss a dose or we miss something by 30 or 40 days, depending on the rotation, it does throw off the sequence. Many of the vaccines, after you get one, you have to wait about 2 weeks to 30 days, depending on the vaccine for that next dose. And that sometimes it's a challenge to get back into a routine. So we do ask and we do recommend is that if they're offered and it's something of an interest to you at the pediatrician, try to stay on to that project or onto that topic that's in place. And again, the goal is it's not to keep you from not getting sick. Immunizations are to keep you out of the hospital. Immunizations are to keep the children out of the hospital, to keep you employed so you don't have to take time off if that's the case. Really just to kind of protect each and every one of us. But we know that we're in that time of the year that kids touch everything. We know that we're coming back to school, that this is going to be the time that we're starting to feel ill. May not be significant, but this is where we want to be able to keep our kids in class, to keep them engaged, to keep them active. We've learned a little bit about social misses, and we really want to kind of keep them as healthy as we can. So that's really the goal from the health department and offering that to all of our partners and our residents, that we're here to kind of just do the best that we can. But you have some parents or so that might say, well, wait a minute, I don't know how safe this is. I don't know if it's the right thing for my child, and that's absolutely okay. What I wanted to share in this slide with you was how does a vaccine work and how does it get approved? So that we know that the manufacturer creates it, they go through what's 3 different types of studies. Once they're comfortable with those studies then get pushed to what's known as the Center for Disease Control. The Centers for Disease Control has a special, what's called a subcommittee. It's called ACIP, or American College of Immunization Practitioners. And these are specialists that look at all of the data over a 3-day period. And they figure out what is right, what is wrong, do they have enough information, or do they feel comfortable recommending it as a new drug? And once they do that recommendation, if they do, it then goes to the Federal Drug Administration or the FDA to sign off and approve that drug. So it goes through different types of studies. And in those studies, they have what's known as adjuvants. So adjuvants is just something that allows the body to work better. You have stabilizers. That's what keeps the vaccine stable in a refrigerated format. There's almost very little to any preservative any longer. That used to be the conversation in the past of what was in it. Most of those preservatives are now all preservative free. So you don't have to worry about, well, what's really going into my child or so. And that's how that works. However, though, they also have what's known, and you see in the top far right screen, is an adverse reporting event. So the Centers for Disease Control has this program that we participate in, that if you receive a vaccine and you don't feel well afterwards, or you think something's not right after that, we report that to the Centers for Disease Control as part of their data collection. Something that we can do on your behalf, or it's something that you as a parent or a caregiver can do on your own as well, where you put in all of the data that you know, and the Centers for Disease Control will do that follow-up as part of that data collection. So that's another reporting mechanism that is very kind of beneficial with that. So along with not only just the vaccines that are important, it's trying to keep everybody as healthy as possible, and kind of knowing where we stand with that. And that's part of what we do as our outreach. When we go out and do our vaccines programs, we've now built into our schedule what's called a Live Healthy program. So we have our vaccination team that goes out, but we also have a group of our dietitians and nurses that go out at the same time, and we do health screenings. So we do blood pressures, we do routine glucose. We try to capture everybody to see where you're at right now and what needs do you have. And if you have a need, how do we refer you? Where can we refer you to? Some individuals don't have that access for referrals. Some people don't have that ability to get care. That's where some of our clinic services could come into play, from our clinical staff, and some of the granting that we have from eye clinics and dental clinics to routine clinic screenings and testings. We have that ability. And the other availability as part of this program is the health education piece of it, with Natalia and her group, to be able to come out to you as partners to offer education, to really kind of pull our directory of services together, to kind of show that what do we do as your tax base to offer you the care that might be needed, or again, another resource available if and when you can't get to a private type of event. As I get ready to kind of close some of this out, the goal is the fall season is to really look at immunizations and to try to keep you and the family as healthy as possible. We're all outside now. As we get into the fall, we kind of move a little bit indoors. We kind of become a little bit closer, but we still socialize. We have a lot of holidays that are coming up this fall. We have a little bit of closeness together. We want to just be able to maybe put a little bit of a barrier between that and whatever that illness is that's out there. And we want to be able to offer that to you. But not only to you, but to all of the caregivers, from the babysitters to the child care centers that you utilize, to give them an opportunity to say, hey, I have a need. Give us that call. Of course, any local pharmacy can do a lot of what we can do. But if it's something of an interest, we can definitely do that for you. And along with our communicable disease team that goes out to the schools to make sure that we meet those minimum mandates that are in place. And we utilize all of that through that documentation that's there. And as the slide says, it takes that village, it takes all of us really to keep an illness at bay, to reduce people from getting sick. And if we can just educate a little bit, we can have an open conversation to point individuals who aren't sure where to go. That's what public health is kind of all about. And that's kind of what I was hoping to kind of get across to the group that's online here today is, we have a resource, we have an open resource, and we have access for you if you should need. So with that, I say thanks for the offer, Jenna, and hopefully I met some of the needs that you asked for.
You absolutely did, Scott. Thank you so much for all this information. You're right, it does take a village to raise children. Oh boy, does it ever. So yes, now would be a good time to do any Q&A. So if anybody has questions, please feel free. It's a pretty manageable group. We can take ourselves off mute and ask, or if you are more comfortable writing into the chat, we can have some opportunity for back and forth interaction. I wrote a couple of questions down myself, but I'd like the group to go first if anybody has anything.
Hi, this is Mariella. My apologies here. I did want to just mention that the first attachment, Natalia, I think it is, with the vaccination sites didn't open up. I requested like a password.
Oh, I'm so
So
sorry.
yeah,
I'm gonna send that. I think I sent it over to Jenna this morning, but I'll try to find another
uh,
option to send in the chat right now.
oh
Otherwise, Jenna,
yeah,
if it doesn't open for you, I'll send you one that does, and we'll send it via email. But let me try and find a different one. Did
yep.
the other attachments work for you, or?
Yes, the other ones
Okay.
did. Yep. So thank
So
you.
just
So
to let
either way,
everybody know, I put the directory of services that Scott had up on the screen in the chat, as well as the health education program book. Our health ed team does really awesome programs for the little ones. We go into schools and we do hand washing programs to help prevent the spread of germs. And then for adults, we have a seasonal illness trends presentation. So if there's anything you're interested in scheduling, then our email is at the bottom of this slide, and you're more than welcome to schedule with us.
thank you. Sounds great.
That's wonderful, Mariel. I just forwarded you the email from Natalia earlier today, so you should have that. If anybody else is interested in that and does not have access to it through the chat, please shoot a little message in the chat box here, or shoot me an email. I'm happy to forward that over to you. Are there questions for Scott and the Ocean County Health Department team? Okay, I'm going to ask mine then. So, Scott, you mentioned the family's right to refuse vaccine due to, medical conditions or, I guess, religious circumstances. Can you talk a little bit more about that process? You said very briefly, just, take some documentation. Can you talk a little bit more about what that situation is like? And also, I was wondering if you had any stats on the families that choose to vaccinate versus the ones that don't, due to illness. Like, for example, my nephew was vaccinated and had really no issues at first, but then shortly thereafter started having seizures. And so I'm just wondering, like, are there any studies that can kind of coexist the two together, like seizures and vaccines, or any type of side effects and vaccines? And if a parent is facing some of those challenges, how can they, moving forward, say, maybe this isn't the right thing for us?
The first question is probably the easiest that's there. So you do have the right to take exemptions, as I talked about, from the medical exemptions to the religious exemptions. There is no formal documentation in the state of New Jersey that says you have to have this form completed. So if a parent chooses to take a religious exemption for whatever that vaccine is, it's nothing more than just a documentation on a Word or a handwritten documentation with a date and a signature attached. And that signature is then accepted by the health department and goes into that school file that's in place. From the medical exemption piece, the recommendation is to try to get a physician prescription or some type of information on a letterhead to support. But again, it could be the same of going back to that second question as well. I think this caused some illness, but we can't prove it. You can do a medical exemption by just written documentation as well. As long as that documentation is within the file for that state NJSA audit, you're fine. It's called self-attestation, and it's just that recommendation that's kind of in place with that. From
Self-attestation, is that what you
self-attestation, so it basically says,
attestation?
I, Scott, choose not to, as parent or guardian or caregiver, makes that acceptable under that state statute, because you are the primary caregiver for that child or that family member. That's in place. The second one, I don't have stats with it off the top of my head without really going back and looking, and that's always a little bit of a challenge, I think personally, just as a clinician, to prove that it was from a vaccine or it wasn't just part of health and genetics, and as they grow up, and as you mentioned, seizures. There's so many different risks of, is it a febrile seizure from an illness, or is it a genetic seizure? Is it an injury type of a seizure? Those are the challenges that I see, and I wouldn't put Jenna in the wrong direction as well. And I could do some of that research if you asked. I think the only numbers that are really in place are what's the percentage of families that say I don't want a vaccine versus that herd immunity piece, as well. And then that's really, and honestly, that's some of the chatter that's going on through the Health and Human Services Secretary that you hear out there of, there's certain vaccines that cause illness. There's certain vaccines that cause sickness down the road that they're still trying to figure out. And that's where the debate is happening now, with our pediatric vaccines is, the government saying one thing, but all the other physicians are saying something different, which is why I didn't put up that 2025 guideline that's in place, because I think it's still too up in the air to really know. And me as a clinical nurse, I don't know if there's one answer to that.
Thank you. Thank you
Kind
for
of a
your
long
honesty.
sidestep, but yeah.
No, thank you for your honesty and your transparency. I know it's not like a one size fits all type of answer. Yeah. Lots of variables there. Thank you for that. And thank you, Karen, for your offering in the chat as well, where Karen says to us, the hospitals and pediatricians' offices provide a form for the family to sign for exemption. So maybe some are, maybe some are, and that's a good thing to know that maybe they should be, or some do, so that families know to ask if they have those concerns, or at least open up the conversation, right? To at least have a transparent conversation with their provider. I'm looking at what Jonathan put in the chat as well. Thank you, Jonathan, for putting this additional resource in here. This is, your vaccine schedule, where you'll be, when you can get it. Okay, wonderful. Thank you. That was going to be one of my next questions, Jonathan. You must be reading my mind. So I was going to ask, I know you offer things through your mobile and out in the community as well. So how can we get connected with you and your mobile if we were, let's say, having a community event and we want to ask you to come out to do vaccines, so that we could get the community vaccinated through you and meet them where they are? How can we schedule that?
So that outreach would be really directly through me, as we put that program together. And I know if you look at that schedule, it's tightly where there's some on there that we do some private events as well based on the needs of closed schools and stuff. We're doing probably 2 or 3 events sometimes a day. So the challenge will be there to come out. But the nice part is if space is limited, we have 2 mobile RV clinics. So we could actually work right out of our mobile units as well. So if the ask is there, feel free. You have that extension there. We can put my extension in, which is extension 7263, and we can have that conversation, see what we can come up with.
Perfect. So scheduling directly with Scott if we have a use or a need for the mobile.
Hi, Mariella again here. And I apologize, I didn't realize my microphone was off, but I think you can hear me, right?
Yeah.
Okay. Do you do any lead screenings?
So we do some lead screenings through our WIC program. That's in place. Most of the screenings are going to be done through the primary pediatricians as well. But if you have an interest or so, we have 2 nurses that are assigned to the lead program, that I can get that information if you have specific questions.
Thank you.
Thanks, Scott. I would be interested in those 2 contacts as well, maybe for the Wellness Rocks event that's going to be happening in Lakewood at Town Square on Sunday, October 5th from 10 to 1. Nice little plug there for our event. We invite you all out. We have a save the date, but we have not sent the flyer just yet. So yeah, if anybody is interested in providing tabling or services, program updates, screenings, let me know. We'd be happy to invite you out. Other questions for Scott? Okay. I don't see anything coming through to the chat box. I'm going to give a couple of quick updates here from Ocean Monmouth Health Alliance. And then if anybody has another update to share, we'd open the floor because we do have some additional time carved out here today. So thank you to Scott and the Ocean County Health Department team for presenting today. The next time we'll have this series will be Wednesday, September 24th from 10 to 11 a.m. It will be virtual just like we are here today. And the topic that we'll be covering is ovarian and prostate cancer. And the Visiting Nurse Association's community health center teams will be presenting on that topic for us. The other thing I wanted to mention is the next couple of days after that presentation, we're going to be having our big event, Vaccines and Veggies. This will be a collaborative event between Ocean Monmouth Health Alliance, the SEED team, the VNA CHCs, Freehold Family Health Center, the Freehold Area Health Department, and Centrastate, as well as Neighborhood Connections to Health. So all of the partners coming together to offer free health screenings and services, all SDOH type services through all of you in partnership. And we'll be at the Freehold Family Health Center from 10 to 1 on Saturday, September 27th. Again, another offering. If you're interested in tabling, come on out. We can set you up. That's one opportunity. I think I just mentioned the Wellness Rocks, which will be the following Sunday, on Sunday, October 5th. Again, same offering. If you have a service or a screening or a program you want to promote, let me know. We'd be happy to have you come out. That's going to be in Lakewood at Town Square, again, 10 to 1. And then finally, the other update I want to draw your attention to is that Ocean Monmouth Health Alliance, as I mentioned in the beginning, falls under the VNA's Children and Family Health Institute. Currently, our whole organization is going through a restructure with our virtual access. And so what that means is right now we're using the Zoom platform, but we're transitioning to the Teams, Microsoft Teams platform. And so some of the existing scheduled meetings that I've been pushing out have old links attached to them. So please be mindful that in the upcoming weeks, months, I'll be sending out new links for the same meetings. So you may think, oh, I already have that on my calendar. I don't need to worry about that email update. But please keep looking for possibly new links. And I apologize in advance for any confusion. But if you're not sure and you're looking to attend something virtually that we're doing and you're not sure if you have the right one, just reach out to me and I will do my best to make sure that we're continuously updating so that you have all the right information to log in. And I think those are the updates that I have here. Looking at the chat. Yes, Tosh, I will. I'm going to send out a big blast for the dates and I'll include the flyers for what both Wellness Rocks and Vaccines and Veggies. And Juliet asks, is there a sign-in sheet? So Juliet, because you put your welcome and great to meet you. Thanks for coming. Because you put your email address here in the chat, I now can add you to our overall list. I do a big e-blast multiple times throughout the month with all these different updates and offerings. So I will add your email address to that list so that you now receive them as well. If there are others on your team that you want to be included in those emails, just drop those email addresses in the chat as well, and I'll make sure I include them in the list as well.
Amazing. Thank you so much.
Thank you. Does anybody have an update from their organization that they would like to share with the group or anything that they'd like to promote? We have just about 20 minutes before concluding. You can take yourself off mute.
I could, Jenna.
Hey, Pete.
How are you? So along with our community health needs assessment that has really, it's contemporary and it is complete, and it is representative of every demographic group, every geographic location in Ocean County. I think it's the newest information out there. There's been no shortage of academic capital that went into preparing it. So that is on our website, and I will put that address. There we go. There's that. In addition, last night, it just dropped our CHIP document, our Community Health Improvement Plan document. What I just left in the chat was our Community Health Needs Assessment. Use it for your strategic planning and applying for your grants. It's there for you. It's free. It's comprehensive. It breaks things down to the singularity, including socioeconomic, social determinants of health, and what we're going to focus on for the next 4 years. But now our public health, as of today, coordinator Dan is reviewing the actual CHIP document. If he approves, we'll have that posted right in the same address as what I dropped in our chat. So that's there for all of your colleagues and your coalition as well. It is Ocean County centric, but we are a very large and diverse county. I think we flip back and forth right between Monmouth County with fourth and fifth largest. Again, the information's there, the largest senior population, the largest population under 18. So it's comprehensive. It's there for everyone to use at no charge. It's just for the benefit of our residents.
Jenna, you're muted. Sorry.
Thank you. Thank you. So I was just going to say, and in addition to what Pete mentioned, if you have not been involved in the community health needs assessment planning process and you haven't had the opportunity to contribute the work that you're doing in the community, Pete is always looking for partners that are in Ocean County to contribute to the plan so that it is comprehensive and inclusive of everybody. We take part annually, and it's a great way to showcase the things that you're doing too. So just a little plug for that. It's always a really nice process, very organized and easy to be involved in.
Real quick, I just wanted to introduce myself because this is my first meeting. My name is Juliet Winther. I'm a tobacco health educator for the cooperative. I also work with the New Jersey Quit Line, which I'm sure most of you have heard of, but just a quick plug, we're a 24/7 hotline available for people who are looking to quit using tobacco or nicotine. It's a really great program. It's completely free of charge to all New Jersey residents. The tobacco program is actually the only program by the cooperative that's statewide, so it applies to everyone. So yeah, really great program. And we also have some presentations and some stuff for kids if you're looking to, introduce them to the dangers of nicotine and tobacco at an early age in a way that's not so scary.
Thank you, Juliet. It's great to have you. Thank you. We hope we'll see more of you. And we typically work with you probably throughout the month of November because it's Lung Cancer Awareness Month to do an AAR training. So if you're the person we would schedule with, we can try to connect offline possibly and work together to get that on calendar.
Yeah, it's actually my supervisor is the person you'll connect with, but I can connect you with her to make that.
Okay. Is that Barbara?
No, it's Maya Shinoy.
Oh, yes. Okay.
Yeah.
Yes.
Mhm.
All right. Wonderful. Okay. Thank you. And again, welcome. Hey, Tosh.
Hey, so I just want to do a little plug for NJ Inc. For everyone who is not familiar with this program, New Jersey Integrated Care for Kids is a care coordination program, and it's designed to connect families to different resources in their communities like housing, food, transportation, pantries, utility services, school-based services. We work directly with the family's pediatricians to make sure that they're getting all the care that they need. So I would love to start connecting more with a lot of you here, as we would be referring a lot of our families to you for services. NJ Inc. is offered through the Center for Medicare and Medicaid. So it's currently only available for families who have New Jersey Family Care who reside in Monmouth and Ocean County. So if you would like any more information about NJ Inc., please reach out to Jenna so she can get a hold of us or get a hold of the VNA NJ Inc. team that we have at their location as well. We would love to be able just to connect with you. Thank you, Jenna.
Thank you. Thank you for being here and supporting our work continuously in different ways today, but always here still supporting.
You know, I'm always in the background.
You are. Does anybody else have an update or a program or service they'd like to share? Thank you, Karen, for dropping some additional resources in the chat box for the group. Okay. All right, I'm gonna check the chat one last time for any questions I might have missed and give Scott.
I have one more.
Oh, okay.
Sorry, in Monmouth County, we're having a free flu clinic in Monmouth County at Jane Booker Family Health Center on Saturday, October 18th. So I can just drop the registration link in the chat really quick, and then if you want to share that. But this is regardless if you have insurance or not, anyone in Monmouth County.
They don't have to have insurance, or they do?
They don't have to have insurance.
Okay. This is great. Yeah, I can put this on our Facebook too, Natasha.
Thank you.
You're welcome. You know me, I'm always looking for ways to fill that page too, so mutually beneficial. All right. Karen's dropping some more things in. Natasha put the events link. Perfect. All right, everybody, I'm going to give you the last couple quick seconds here as I do our outro to thank everybody and get yourselves the links that have been posted in the chat before we conclude. Again, another huge thank you to Scott Carter and the Ocean County Health Department team. Thank you to all of you for being here and spending your morning with us. Again, hopefully we'll see you on September 24th for ovarian cancer and prostate cancer awareness. And everybody have a great morning. Thank you. Take care.